Picture the scenario. You walk into McDonald's to grab lunch when you're met with an endless line of hungry customers. The understaffed employees are running around to catch up. You order a meal, wait for a painfully long 20 minutes. When you get home, you find that your order was slightly messed up. You asked for no cheese on your sandwich. The soda was not a diet, and there's no ketchup to go with your fries. Now your meal may be ruined, but I think all of us can live with that. Now compare it to this image of a local community pharmacy with a similarly long line. Frustrated patients are waiting to pick up their life-saving medications, and the one pharmacist and technician on duty are also running around. The difference here is a mistake can be fatal. But why are our pharmacies being run like fast food chains? It all comes down to one word: efficiency. For centuries, humans have been obsessed with achieving, improving, and perfecting it. We constantly want more for less, and we want to produce less waste. Now, efficiency can be described using this simple formula as output over input. And efficiency is inherently good. However, when we apply the same exact industrial formula to human healthcare, things can go wrong. Let's look at the current state of American healthcare. For input, we can look at spending, and it is a lot. The United States has the largest healthcare spending in the world, more than twice as much per capita compared to other high-income countries. The ultimate output in healthcare is life expectancy. For this amount of spending, we expect to live twice as long as other countries, right? It is shocking to find that we generally live shorter lives, and we rank between 40th to 50th worldwide, which gives us this scary graph of healthcare spending versus life expectancy, where the US is a definite outlier. Clearly, there is lots of waste and much room for improvement. But to understand where the system goes wrong, we have to look at the front lines. We have to look at the pharmacy counter. Using the formula again, a pharmacy's output is simple: prescriptions dispensed. The input includes the medication costs and the labor hours required to dispense them. Now, because drug margins are already incredibly thin, what pharmacies do is they try to produce the highest volume of prescriptions for the least amount of staff hours to achieve maximum efficiency. And while this may save a pharmacy maybe a couple dollars on each prescription, if we zoom out, this actually leads to much higher overall spending elsewhere on the system. Why does this happen? At the end of the day, a pharmacy is a business, and it is paid by insurance companies almost exclusively for the transaction of dispensing pills. However, a pharmacist does a lot more than just put medications in a plastic bottle. But profit incentives make it easy to disregard these clinical responsibilities and focus solely on the moneymaker, the volume of prescriptions dispensed. This puts an impossible strain on the staff. And when humans are pushed past their limits, mistakes can happen. Except this is not a missing piece of chicken nuggets or the wrong dipping sauce. Every year, 1.5 million people are injured by these errors. Right now, 1 in every 9 emergency room visit is caused by a drug-related issue. And these preventable errors cost our healthcare system $21 billion every year. Why does this happen? There's a famous principle in economics that explains how we got here, called Goodhart's principle. It states that when a measure becomes a target, it ceases to be a good measure. When filling a certain quota of prescriptions per hour becomes the target, we lose sight of the human being on the other side of the counter. Imagine going to your doctor's office, where your doctor is also the receptionist checking you in, the nurse taking your vitals, and also the billing representative on the phone with your insurance company. Would you trust a doctor's visit that lasts for exactly 1 minute while they juggle all of that? Of course not. But that is the reality that pharmacists are pushed to. Picture this. Right now, pharmacists are meant to prescribe 300 prescriptions in a single 8-hour shift. If you work out the math, this comes out to around 100 seconds a pharmacist can spend on each prescription. In those 100 seconds, they have to verify the dose. They have to verify the entire medical history of the patient. They have to make sure that the antibiotic they just prescribed is not going to interact with the blood thinner that the cardiologist prescribed last month and cause internal bleeding. They have to do that while administering a flu shot, counseling a patient at the window, running a retail floor, and having 2 calls on hold. And with this little time, error rates increase significantly. Now, this doesn't just harm patients and cost the economy. It also affects the professionals trying to protect them. Every day, pharmacists are clocking out, exhausted, suffering severe psychological injury. They go home terrified and worried that they may have unknowingly hurt someone simply because they were forced to work too fast. So how do we fix this? We must change the metric. We must make patient-centered outcomes the actual measure of success. We need to overhaul the pharmacy reimbursement system so that it aligns with patient health, paying pharmacists for their clinical expertise and their interventions, not just their speed. But what can you do as a patient? Well, the next time you are in line, waiting to pick up your or a loved one's prescription, take a deep breath. Note that this dreadful 15-minute wait is meant to save someone's life, and possibly yours. Thank you.